With Xtraordinaire, it's the French association, and it has a particularity versus ACD, for example. It is a multi-syndrome association, so it's aimed for all X-linked, very rare disease with neurodevelopment disorders and intellectual deficiencies. So we have like more than 60 syndromes within the association, and we work within commission. We have commissions. So for example, the CTD commission is a big commission, very active, but we have also other syndromes with very active commission. And for some syndromes, we have only one family or two families, so it's less active, but still it's important for them to find a place where they can meet other families and talk about their children and maybe go to, like we did for many years, try to find a treatment or help. So that's the main things we're doing, main goals. I'm going to be quick because, you know, we don't have much time. So basically we're trying to be here for the families, but not only. We are really working on a network in order to develop medication, to work with people like Alois at the CEA. And we have been so far quite successful because you see everybody is here today, and we're really glad to see you. So this is the CTD community in our association. So we have 84 CTD patients, 90% boys and 10% girls. There is 73 families because we have siblings. So we have 9 families with 2 children, boys and girls, but mainly 2 boys. And we have 1 family with 3 CTD children. And on the chart bar here, you will see the age of children, the boys in blue and the girls in pink. Sorry, it's... and... So you have an idea of the population. So we have a lot of patients above 15 years old and less patients under 15 years old. So we think, like Heidi emphasized, that it is very important. The patient groups are very important. So we think you have to realize that engagement, empowerment are keys to success, to like have better care for our kids, but also to get maybe to a treatment and to have more visibility. So we face a lot of challenge within this disease, like you know, isolation. You're not always in the right region in France, for example. It's like difficult to find help or to find the right doctors. So we really encourage local initiatives, and we are really trying to have this network, as I mentioned, to make sure our kids you think about them. So it's just a list, and you know, I won't go through all the points. And so what really we want about empowerment and engagement? We think knowledge is the power, because it's very important, and ACD has proved it within like this parents group. I'm part of it, so I can tell it's really helping to know what you know about the disease, how you can educate over family to speak about their children, their needs, and also to talk about the research, maybe in simple way sometimes, to make sure everybody gets what's going on. And I think it's really important. And also the support networks. So as I mentioned earlier about, you know, connecting patients, meeting, professionals, and to have really a sense of the community you belongs to, and that's an important part. Then advocacy for research. So I won't go too much about it. Today it's a good example of what we can achieve. And it's very important that the clinician, the researchers listen to the families and what is important for them versus what could be important for the regulators and the trials. And also all the care cursus, which is not easy depending on the region, depending on the families too, the willingness of the parents to do things. So it's very important to have this discussion. So at Xtraordinaire, we have this Facebook Messenger group, and it's very helpful for small things, more important things, and I think it's working quite well. And we're trying to give like more and more advice in order to have these tailored care plans to find the right people. They cannot have a meeting with a pediatrician or neuropediatrician. We find someone that could see it. We do that with Fanny Moschel, for example. Each time we have a children becoming an adult, we ask Fanny if she can have this adult and see it. And it's really, really helpful and helping the family. So we think that together we are stronger. And the collaboration with ACD is a good example of that. So we're a global community, no language barrier. And you see we did good with the translation today. So it's possible for everybody to attend these meetings. The cultural diversity is a strength, and it's important. We don't have the same expectation, but still it's very important. So unity, for me, it's key in addressing the challenge posed by very rare disease like CCDS. And then the power of collaboration with the clinician, the researcher, the labs, all the health community, you're working quite well, you know, and you see that we're still in contact years after years, and we are also bringing new people talking about the disease or, you know, the biomarkers or other things. And we really think that it can be helpful to maybe to help with the regulation, to have some impact on the rules. You know, you were saying earlier, they may not be keen with this or this, but we can have an impact too, and it's important to be linked with the people in charge. So joining the force critical in advancing research and treatment options for our community. And this is a slide from last year. We did a survey last year. I think people in Utah may remember. We did a survey with our community, with asking like what was important for them, and that was the conclusion. So the main concern was aging and fears of what will happen to the children, worsening health and behavior, the hope, the treatment. And if you look at the question below, the observational study, 50% yes and 44% not sure. But if you see what the people enroll in Aurore Curie study, it's more like 80% yes. Though we see that some hesitation with the association. We have been able to have these calls with Aurore to make them feel very comfortable about coming, even though the MRS was like the key black point, because people say, oh, I won't go because mine, it cannot do anything on that. And finally, most of them were able to achieve like most of the tests and even the MRI testing.